Why is this really, really bad news for all of us, not just nurses? Part of Trump's One Big Beautiful Bill Act actually changed loan repayment programs, setting a higher annual cap for professional degrees at $50,000 a year compared to other graduate degrees at only $20,000 a year. The concern is that not just nursing, nurse practitioner, physician assistant, physical therapy, occupational therapy, social work are all now no longer considered professional degrees. This is terrible news for a system that is already struggling, where we have major nursing shortages and where there are also physician shortages, and physician assistants and nurse practitioners are filling the gaps in a lot of places, especially rural areas. Also, take a look at the types of fields that were removed from professional designation. A lot of them are female dominated. Compared to the fields that are still considered professional degrees, including chiropractic and then also theology. Now, my husband has a PhD and a master's in theology, but just to point out that that is likely on there because of political reasons. No, this is actually all part of Project 2025, where they wanted to privatize all loans, get rid of public service loan repayment, and eventually dismantle the Department of Education, which is already happening. I've also seen comments, and this is very astute, where a lot of these fields are mandated reporters when it comes to child abuse. So nursing, teachers, social workers. I have no great call to action. I don't know if a public outcry is going to do anything or if this is a done deal. Please keep talking about it. And this is incredibly important to learn the ramifications of your vote. You may do knee-jerk vote because of X, Y, and Z, but you can cause serious consequences down the line that can basically hurt the entire healthcare system and your own interests.
Guys, across the world, healthcare is built on more than medicine. It's built on human care. Hey beautiful people, welcome to my YouTube channel. Thank you for stopping by. So all credit goes to the creators in these videos. Guys, healthcare is built on human care. Listening, comforting, watching closely, protecting, acting fast when something is wrong. Nurses carry that every single day, and they are not just workers. They are guardians, they are listeners, protectors, and sometimes, and most of the time, guys, they are the last friend of the patient that has practically nobody. They are always the friends that the patient has. And this is why this decision is surprising so many people, and it's really, really paining so many people, because they feel like, okay, if you say nursing degree are no longer classified as professional degrees, it changes, how people perceive and see the nursing degree, either you like it or not. And I've watched so many videos and read so many comments. People are saying that this change, it affects student loans, scholarship opportunities, and educational support. And more than that, it affects how we see nursing as a professional, because some people are like, okay, why do I need to even bother? Go, you make all those suffering, sleepless nights, nursing school, this and that, graduate, become a nurse, and then you say you don't classify me as a professional. Now, it raises questions bigger than education, because the first question is that, do we actually value care work? Do we see it as a real expertise, or do we only respect jobs that have status, power, or higher salaries? And guys, it reaches into the heart of how the society really values this. And looking deeper into it, many people are saying that this decision affects women the most, because nursing is a female majority profession. Guys, what do you think about this in the comment section? Is this really about budget, or is it about power? Is it about respect? And why do professions that focus on care and emotional labor, why do they always struggle for recognition? Because this is not just happening in nursing, it's happening in social work, teaching, elderly care, child care, and all of this. Guys, let me know your thoughts in the comments, because all these jobs require heavy emotional energy, heavy, and emphasis on the heavy emotional energy, but they often receive low pay, low support, and low status. They are essential, but they are rarely treated as essential. Let's see what these other creators have to say, and I'll see you soon.
Trump's Department of Education just made one of the most destructive, backward, absolutely nonsensical decisions I've seen in a long time. And that says something. They've officially removed nursing from the list of professional degree programs under Trump's One Big Beautiful Bill. And before anyone says, oh, that's just a label, no. This means hundreds of thousands of nursing students lose access up to $200,000 in federal student loans. Let me say that again. In the middle of a nationwide nursing shortage, the administration has decided that nursing isn't a profession worth funding. Nurse practitioners, cut off. Physician assistants, cut off. DNP programs, good luck. Your master's, your PhD in nursing, too bad. The American Nurses Association is begging the administration to reverse this, because it will crush the future workforce. And they're right. Nurses are literally the backbone of the entire US healthcare system, the ones who actually keep hospitals running, who staff underserved communities, who take on the majority of the patient care, and the government just told them, you don't count. This will devastate rural healthcare. This will destroy nurse pipeline programs. This will push people out of the field when we already don't have enough.
So to sum it up, this means increased student loan debt, impact on demographic disparity, and more challenges to marginalized group. So students pursuing advanced nursing degree at the graduate level will most likely end up with financial burden, which in turn contribute to greater demographic disparity within the field, because marginalized group find it difficult to afford such higher level of debt. And this is not helping.
Guys, professional degrees in America like medicine, pharmacy, dentistry and law allow students to borrow more money from the government. And nursing used to be part of this group, but now it is not. So the government is saying that student debt is too high. Some graduates borrow very big amounts, so they decided to limit which degrees get strong financial support. They kept high status fields on this list: doctors, dentists, lawyers, but nursing was not included. Guys, do you actually think it's fair that nursing was not included? Because what they are saying in essence is that nursing is not as important of a profession. Is not, because that's the way I see it. They are trying to say it's not a professional degree. It's guys, make it make sense to me in the comment section, because according to them, they want to reduce student loan debt, they want colleges to lower tuition fees, they want to save government money, they want to create tighter rules for borrowing. So officially, this is a financial policy, and so many people are saying it's not an attack on nursing, that nursing is not the only field that was dropped. But many people disagree, and they are like, okay, looking at all these fields that were dropped, what do they all have in common? The fields removed are mostly care jobs. Most of these nurses are women. Nursing is essential but not treated as important. And guys, I feel this may push many people away from healthcare. And the hospitals are already short of staff, because they'll be like, if exactly, this is happening, and the nursing I'm going to slave for and go to nursing school for, and, burn the midnight candles on, is not even going to be respected. Why do I need to do so much? Guys, let me know your thoughts in the comment section. Let's see what these other creators have to say.
So the Trump administration works to remove nursing, physician assistant, and nurse practitioners away from the professional degrees. I mean, I guess I don't see what the big deal is, because we're certainly not professionals. Certainly not professionals when we miss our own families' major milestones or holidays with them and birthdays with them, so we could be at work taking care of your families or people who don't have any family. Not professional when your family member is crying to me about how tired they are and I tell them to keep fighting because it's not their time yet. And I also don't think it's very professional of me when I'm working with a patient and I hear code blue over the loudspeaker, and I stop everything I'm doing to run to a stranger so I can help provide them life-saving measures regardless of their statistical outcomes and odds. Or how about when said patient doesn't make it, but I don't have downtime to truly process those emotions and feelings. I have to move on to my other patients and walk in their room with a smile because they are still fighting for their lives and they deserve every bit of me. And I definitely don't think it's professional when I have a patient tanking in my room, whether it's blood pressure, heart rate, and or O2 saturation, and I go grab who? My provider, being my physician assistant and or nurse practitioner, to come to the bedside so we can do everything we can to prevent this patient from coding. Maybe when the doctor comes in to explain the procedure that the patient is having, and at the end he asks the patient, oh, do you have any questions for me? And the patient says no, so the doctor leaves. The patient then asks me 10 questions and says, I just didn't feel comfortable asking the doctor any questions. Not because the doctor was incompetent, but because I'm the one who built the trust relationship with that patient, and they're more comfortable to ask me, their nurse. Or maybe I'm being professional when the custody patient down the hall who's there for rape, murder, or child molestation needs care, and I have time to put in my own values or beliefs on the situation because it's my job to give them the basic care that they deserve as a human being, regardless of the human that they are being. I think I'm definitely being professional when wait. I'm sorry. Is the argument that we are professionals or that we aren't? I think I'm getting confused.
The argument is that you should be a professional, degree, but you are not. And many people are saying that there's not enough nurses, there's not enough caregivers. The burnout is rising. Post COVID exhaustion is real. Stress is increasing. Many are leaving, and fewer people are joining. Because the truth is that a healthcare system without strong nursing will not survive, no matter how advanced technology becomes. Because talk of AI, you can have it, you can have robots, you can have apps, you can have tablets, but when someone is in pain, guys, none of that matters. Sometimes the only thing that can suit your pain is a human voice, a human touch, a human heart. And we all know, if we are going to be honest with ourselves, that doctors do not have that time. The people that can, that are closest to doing that for you are nurses. So this is why people are pushing new ideas. Should nursing become part of the STEM? Should care work receive the same respect as technical work? And should emotional labor be treated as real labor? Guys, I really need to know your thoughts in the comments concerning this. Do you agree or do you disagree? Because I believe that a strong country is measured by how it treats the people that care for others. Guys, this should be more than saving money. I really believe so. Anyways, let me know what you think about this in the comment section. I really want to hear from you. And if you found value in this video, don't forget to like, share, and subscribe. And I'll see you in my next video. Please stay safe. Mental health is important. Ciao.